FIFPRO, the international organization that represents the interests of some 65,000 footballers worldwide, has released the findings of a study that professional soccer players and other athletes who suffer concussion are more likely to report anxiety, depression and sleep disturbance after their career, according to that new research. Now, surveying 576 former First Division footballers, ice hockey and rugby players from Finland, France, Ireland, Norway, South Africa, Spain, Sweden and Switzerland, the study was conducted by sports medicine experts from the University of Cape Town, as well as Japan and other parts of the world. I'm now joined by one of the key researchers, Professor Mike Lambert, from the University of Cape Town's Exercise Sciences and Sports Medicine Department. Good morning, Professor Mike Lambert. Thank you so much for giving us this time. Could you please give us an idea of what this study actually entailed?
Good morning, Kendall. Well, the study is actually led by Vincent Gartebach from Holland. And the reason that's important is because he was an ex-professional football player. He played professional football for France for a number of years, and then he became a sports scientist. So he's got this interest in head injuries from a player's perspective, and now he's looking at it from another direction, that from a scientist's perspective. And he noticed when he was a player that many of the retired players seemed to show symptoms of distress. So that was really the catalyst for us doing the study. And he's now led several similar sorts of studies around the world, looking at different types of sports people and trying to make the link between professional sport and life after playing professional sport. Now, we know that many professional sports persons participating in contact sports do get concussions, as it's almost accepted as being part of the job. But we were interested in seeing what are the consequences of a player who's had several concussions throughout their career. So we surveyed a group of ex-professional players from a number of different sports, football, ice hockey, and rugby in this particular study. And we asked them a series of questions which all linked to their what's called common mental disorders. And those are symptoms of distress, anxiety, sleeping disorders, and substance or alcohol abuse. So those were the common symptoms of mental disorders that we really focused on. And the first point was to find out just how many concussions the players had sustained during their careers. And we were surprised that nearly 30% of the players had got 4 concussions or more during their careers. And what surprised us even more was that those players who had had 4 concussions or more had an increased risk of getting these common mental disorders that I've described. So there's a clear association now between getting head injuries spread out over a career and subsequent common mental disorders as a retired older player.
Professor, can you let's just jump right into the nub of it as well. Can you tell us what kind of mental disorders are we talking about? Because I do know that anxiety and depression is something that crops up around about this time of the year, for example, for a lot of people. Are those the kind of illnesses we're talking about? What about maybe even domestic violence and so on and so forth? What have you found?
Well, the common mental disorders that we looked at really are the ones that common society experiences as well. So these are the mental states that detract from having a good, fulfilling life and, cause disturbances. They might manifest as family abuse or domestic violence. It can manifest as in a number of different ways. It's individualistic. It depends on the person how it actually manifests. But it's certainly, I think the common thread is that it detracts from a good, wholesome, happy, fulfilling life.
Right. Now, one of the things that came up on immediately hearing about this study, Professor, was me remembering the research that was done in the States. I'm talking specifically of CTE and how National Football League players were finding themselves suffering from different mental disorders after their playing careers, from as young as like high school and college and professional footballers, as well as boxers as well. Is there some kind of a link that can be found between your study and your research as well as what was done in the States?
Yes, I think there is. You know, our study was looking at specific diagnoses of concussion, and usually the traditional diagnosis is that the players, you know, loses consciousness, and then there's a short-term loss of memory. You know, that would be a classical case of concussion. But more modern definitions suggest that you don't have to lose consciousness at all. So any head injury would be regarded as a concussive injury. Now, CTE, or chronic traumatic encephalopathy, is a condition which develops after repetitive head injuries. So they don't have to be serious head injuries, they're just head injuries that occur over a long period of time. So if we look at boxers, for example, they might go to the gym and spar, even with headgear on and heavy gloves, but it's just that repetitive banging on the head that develops a condition which is now known as CTE. And this is a really, it's got very important, serious consequences. Firstly, it's a condition that's very much in the spotlight at the moment. It's in a phase of learning a lot about it. So, you know, 10 years ago, not too much was known about it. And now with all the publicity about concussion and head injuries and the consequences of head injuries, there's a lot of focus on CTE. And I think it's affecting, certainly affecting sports people, the way they engage in their activity and, you know, in terms of administrators who are now looking at rules. So we're in a phase where there's lots of change going on. Attention has been drawn to the consequences of head injuries, and I think now there's a reaction trying to firstly understand the medical associations, what are the consequences, and then secondly trying to come up with ways of preventing them in the first place.
You talk about changes and how much all of this has come into like focus of the public as well as administrators and rule makers. Different sporting codes have got different protocols. We know how it's dealt with in the world of rugby, for example. But having said that, in the world of football, professional football at the highest level, just last night there was a match in where two players knocked each other, both trying to hit the ball, both knocked out, both ended up playing the rest of the match with bandages around their heads. But they're not taken off for any test. They didn't get knocked out, not taken off any test, and carried on playing. Are we talking about change in that kind of field as well?
Most definitely. I think the sports in which the risk of head injuries is highest are the ones that are having a leadership role at this stage. So rugby has got very advanced strategies in place now to protect players, and it's work in progress. And I think the sports where the risk of concussions are lower are kind of following along and slowly starting to realize the importance. It's not just the administrators that really need to be targeted, though. I know in rugby they've also counseled the commentators as well to refrain from trying to make out that a player's tough when he gets a head knock and then stands up and carries on playing. You know, often the commentators would have said, oh, so-and-so's tough as nails, a head knock's not going to keep him down. And, you know, that sends out a message to the public that toughness overrides any potential injury. So I think in addressing the problem, it needs to be at all levels. It needs to be at the medical level. It needs to be at the administrative level where they look at rule changes to reduce the risk. It needs to be at the commentators level. It needs to be at the parent level. When children are involved, they need to understand as well that if their child gets a knock on the head, it's not a case of toughness whether they continue or not. It has serious health consequences. So I think the more attention that's drawn to this condition, the faster public awareness will be created, and then, you know, hopefully the impression about getting a head knock and what, you know, whether you're tough or not, whether you can carry on, you know, those misnomers will be dispelled.
Professor, in South Africa, have any of the federations and associations reached out to you and your team to see if they can get more information as to how to dovetail your research and your findings to make sport safer for children in primary school, for professional athletes. Have any of them reached out to you yet?
Yes, we work very closely with South African Rugby. They have a program called BoxSmart, which is designed for rugby safety. And we've had a collaboration going on with them now since 2009. And they've done some amazing work making the game safer. And much of their focus is on youth, because those are the population that are vulnerable. And so their information's in the public domain, so people from different sports can go and look at what has been done in rugby. If they just go to BoxSmart, www.boxsmart.com, there's an abundance of information, their guidelines for concussion, how to recognize a concussed player, what to do when a player gets concussed. So it's very practical information that's been designed for consumption by the public.
Dr. Mike Lambert, thank you so much for giving us this time to chat about the work that you've been doing. Really good work, and sure hope that a lot more people catch up to it and start using it in how they administer all sports.
Thanks, Kendall. My pleasure. Yeah.
There you have it, Dr. Mike Lambert from the University of Cape Town, and he was chatting to us about some key research that he's been working on about concussion and how it affects ex-athletes way after they played their sport in the field of play.